Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, daily we are discussing some important questions, system-wise questions, subject-wise questions from here. Today we can discuss some important questions for coming exam. An older client recently has been taking cimetidine. The nurse monitors the client for which most frequent central nervous system side effect of this medication. And our options: first option A tremors, option B dizziness, option C confusion, option D hallucination. In this question, an older client is taking cimetidine. Cimetidine is an example for H2 receptor antagonist. Okay, so patient is taking cimetidine and the nurse is monitoring that patient, and which is the most frequent central nervous system side effect for this medication. This is the question. As I already told, the cimetidine is an example for H2 receptor antagonist. So if an older client who is taking the cimetidine is susceptible for central nervous system side effect. The most frequent central nervous system side effect is confusion. So here option C will come correct, that is confusion. And the remaining option, tremors, dizziness, hallucination, all is there. These are the some less common central nervous system side effect, but the most common central nervous system side effect is confusion. The other side effects include headache, dizziness, drowsiness, or some other side effects. Other example for this H2 receptor antagonist include cimetidine, nisatidine, famotidine, and ranitidine. The next question: the client with a gastric ulcer has a prescription for sucralfate 1 gram by mouth 4 times daily. The nurse schedules the medication for which time? Options: option A, with meals and at bedtime. Option B, every 6 hours around the clock. Option C, 1 hour after meals and at bedtime. Option D, 1 hour before meals and at bedtime. Here in this question, the client with gastric ulcer is taking sucralfate 1 gram. Sucralfate is an example for gastric protectant. So the client is taking sucralfate. At what time nurse can schedule this medication or nurse can give this medication? This is the question. This sucralfate is a gastric protectant which is usually given orally and is given 1 hour before meals, or it should be given on empty stomach. So correct answer is option D, 1 hour before meal and at bedtime. That is the correct answer. The main action of this medication is to form a protective coating over the ulcer. Here the patient is having gastric ulcer, so it forms a protective coating over the ulcer before food intake and stimulate gastric acid production. So here option D, 1 hour before meals at bedtime is the correct answer. The next question: the nurse has given instruction to a client who has just been prescribed cholestyramine. Which statement by the client indicate a need for further instructions? Options: option A, I will continue taking vitamin supplements. Option B, this medication will help to lower my cholesterol. Option C, this medication should only be taken with water. Option D, all of these. Here in this question, a nurse is given instruction to a client who is taking cholestyramine. Cholestyramine is an example for bile acid sequestrant. Okay, so while hearing the patient statement about taking medication, what instruction does the nurse will give to this patient? This is the question. The main use of this cholestyramine or bile acid sequestrant is to treat hypercholesterolemia or to lower the blood cholesterol level, and also biliary obstruction and pruritus associated with biliary disease. While giving this medication, the patient will experience some taste difference. Okay. In order to avoid that, during the consumption of medication, patient can use some fruit juices or some other juices. So while hearing this medication should only be taken with water. That time nurses should give some instruction that along with some juices you can take this medication, that the nurses should explain to the patient. The other options, option A and B, is not appropriate for this question. Patient can take vitamin supplement during the medication, and also patient this medication is given to lower blood cholesterol level. So here option C will come correct. The next question, an example of antidiarrheal medicine. Options, option A diphenoxylate with atropine sulfate, option B metoclopramide, option C nizatidine, option D formatidine. Here, which one is an example of antidiarrheal agent? That is the question. So, correct answer is option A, diphenoxylate with atropine sulfate. That is known as Lomotil. Okay, diphenoxylate with atropine sulfate is also known as Lomotil. It is an antidiarrheal agent. And also other antidiarrheal agent it is there. Diphenoxin with atropine sulfate is known as Motofen. And loperamide is also known as Imodium. Okay, these all are some example for antidiarrheal agent. The next question, an example of antiviral influenza medication is. Options are option A nalafenac, option B loratadine, option C is enamavir, option D all of this. Correct answer is option C is enamavir is an example for antiviral influenza medicine. The common antiviral influenza medications include amantadine, oseltamivir, erimantadine, and zanamivir. These are all some example for antiviral influenza medication. The next question, vascular lesions caused by dilated blood vessels is known as. Options are option A telangiectasia, option B ataxia, option C vasculitis, option D vasodilation. Vascular lesions caused by dilated blood vessels is known as. Option A telangiectasia is known as vascular lesions caused by dilated blood vessels. Move on to next question. A grandiose deletion occurs in which of the following disease? Options are option A OCD, option B schizophrenia, option C manic disorder, option D phobia. Correct answer is option C manic disorder. Deletion of grandiose is usually seen in manic disorder. Option C is correct. The next question, why chlorpromazine is usually not administered by intravenous route? Options are option A, it causes dystonia, option B, it causes tremors, option C, it causes hypotension, option D, it causes cerebral edema. Here correct answer will come option C, it can cause hypotension. Chlorpromazine is an example of typical antipsychotics. Usually this is given IM, that is deep intramuscular route is preferable site for this chlorpromazine injection. If we are giving intravenously, there is a chance of hypotension. So we are not usually given through IV route. The next question, method of administration of haloperidol injection is by. Options are option A is a drug method, option B intravenous, option C subcutaneous, and option D by transfusion. And the correct answer is option A is a drug method. Haloperidol is usually given in deep IM, that is Isotract method. It is mainly to prevent irritation and also backflow of content. So we are giving through Isotract method. The next question, how long we should soak an instrument to get high level of disinfection in 2% glutaraldehyde? Options, option A 30 minutes, option B 20 minutes, option C 15 minutes, and option D 10 minutes. Here the correct answer is option B 20 minutes. To get high level of disinfection. We have to keep the instrument up to 20 minutes in 2% glutaraldehyde. Usually the range we are keeping instrument in 2% glutaraldehyde is 15 to 20 minutes. 15 is the lowest range and 20 is the highest range. So here option B is the correct answer.